In this video, I want to combine two of my biggest passions, running and sports injury physiotherapy work. And I want to talk about the 7 most common injuries related to running that we see in our sports injury clinics. So let's go. Thanks for checking out the channel. My name's John, head therapist here at John W Sports Injury. It's great to have you here at the channel. Here we want to do 3 simple things. We want to help you to understand your body. We want to make sure that you can get rid of that pain so you can finally go on to achieve those sport, exercise and well-being goals. So if you haven't subscribed and that sounds like the type of stuff that you want to be checking out, make sure you hit that subscribe button, hit the bell notification, and I'll keep updating you with this content. But let's talk about these 7 conditions that we see commonly in our sports injury clinics that are related to running. But before we dive in, what I want to say is that this is going to be a brief video talking through the conditions, because in truth, each of the conditions deserves a video in itself. But what I want to do is summarize these conditions, and then I'd encourage you to check out these conditions in more detail if you think that they are related to you. And I'm going to be giving some general guidance. If you think that you're suffering with any of these pains or conditions, I strongly advise you to dive into a bit more detail and to get these assessed by a medical professional so that you can understand truly what you're suffering with and how you're going to overcome it. Feel free to reach out to us. I'm going to link it below with some of the information of how you can speak with us, and also some of the other videos that will dive into more detail about these particular conditions. But let's start at the bottom. Running is something that requires our feet to hit the ground, and as a result, we do tend to see a lot of injuries around the foot and ankle area. Now, the thing I always say about running is that if we have an issue in the body with our biomechanics and that leads to dysfunction, that running, and in particular long distance running, is going to find those dysfunctions. So let's talk about the foot and ankle. And the first condition, we'll start at the very bottom and we'll work our way up the lower limb. So what we call plantar fasciitis, and this is one that I often call the hobble to the bathroom condition, because it can often affect us first thing in the morning when we get out of bed, and so we find ourselves hobbling to that bathroom to get going. So if you're suffering with pain on the underside of the foot, particularly in the arch or the underside of the heel, this is very typical of plantar fasciitis, and this is what I often term a secondary injury. I find that this comes about as a result of some issues perhaps further up the chain, which we're going to come on to. But the plantar fascia is a layer on the bottom of the foot, and it's this fascia tissue. Fascia is, we're going to talk about fascia a bit further down the line in the video, but to understand what fascia is compared to a muscle, is fascia is the outer layer of muscle. I describe it a bit like an onion, where we have the bulk of the onion, which is the muscle, then we have the skin of an onion, which is related to our skin, and then between that you have that plasticky layer on an onion. And that's very much what like fascia is. It's this surrounding of our muscles, but we have particularly thick, dense bits of those fascia on our body, one of which being the plantar fascia. So plantar fasciitis is where we get an irritation, a problem, pain being caused by a problem in the underside of the foot. The second condition related to that is Achilles tendinitis. Now, the Achilles tendon links the calf to the heel. So the tendon joins a muscle to a bone, and in the case of the Achilles tendon, that's our calf complex being joined to the heel, or our calcaneus, by a tendon, and that's called the Achilles tendon. Now, one of the things that's often misunderstood about the Achilles tendon is just how large it is. It actually runs from the heel right up to the kind of lower third of our leg. So it's a much bigger tendon than people are aware of. We can feel that kind of stringy part of the Achilles tendon in the back of our heel, and that's very common to suffer some pain or some dysfunction. But as with any tendon injury or issue, this comes about by a dysfunction in the muscle that is attaching to that tendon. So what we typically experience is pain in the back of the heel. We can feel a pulling, soreness, very acute sensation, often very sore to touch the Achilles tendon when we suffer with Achilles tendinitis. And you might suffer pain on things like walking up or down the stairs, or certainly when we go out on our runs, we start to notice that pulling sensation and that real sore discomfort at the back of the heel area. So that would be typical of Achilles tendinitis. And as I say, very common, and what we want to be investigating, is both the flexibility and the strength and the overall tissue quality of that calf complex. The calf comprises 2 main muscles, being termed the gastrocnemius and the soleus. But within that complex, we also have a deeper muscle called the tibialis posterior muscle. And this brings me on to condition number 3, which is what we often term PTTD, or posterior tibialis tibial dysfunction. But essentially, this is where we may be suffering with pain wrapping around the inside of the foot. So the tibialis posterior has a tendon that wraps around what's called your medial malleolus. So that inside bony bit of your foot, the tendon literally wraps around there and comes and attaches onto the inside of the foot. So if you're suffering this pain on the inside of the ankle that you're finding to become very sore when you finish runs or during runs, that may be typical of this tibialis posterior issue, or PTTD to give it its full name. So they're the 3 conditions around the foot and ankle that we tend to see a lot of, and they're very interlinked. It might be that you suffer with more of one of these conditions, but we have plantar fasciitis, we have Achilles tendinitis, and we have tibialis posterior dysfunction. Moving further up the chain towards the knee, everybody knows, or people often say to me, that running is associated and bad for the knees. Well, firstly, for us runners out there, the research is not necessarily supporting that. And actually, for long-term knee health, running can be quite beneficial. But having said that, when we have an area of dysfunction or some biomechanical insufficiency, what that can do is lead to pain that is presenting around the knee joint, even if it's not necessarily the knee itself. So let's talk about those. Now, one of the conditions is what we term runner's knee. Now, obviously, runner's knee is a good place to start when we're talking about running injuries related to the body, because we do see a lot of runner's knee. But it's important to understand that actually runner's knee isn't necessarily the inner workings of the knee joint itself, but it presents itself with pain on the very outside of the knee. What we have here is a thin bone in the leg called the fibula. Now, why is this significant? It's significant because we have a big structure called our iliotibial band, or the ITB. Again, if you've been around much of the running community, this is a very well-known term because it can cause a lot of dysfunction. This relates back to the fact that it's not a muscle, but what we spoke about earlier, it's another area of this thick bit of fascia. So we have this thick fascia running from our hip, running right the way down to the outside of the knee. So this effectively connects our glutes to the outside of the knee, but it's actually onto the fibular head rather than the knee joint itself, or the main knee joint itself. And what can happen is if we have dysfunction in any of the areas around the hip or the outside of the thigh, the hamstring, all these muscles that we're using a lot when we're running, it can start to pull and irritate on there. So if you're getting pain very much that feels like it's on the very outside of the knee, running up the outside of the leg, it's worth checking out a iliotibial band issue, or what we call ITB friction syndrome to give it its full name. But we often term this runner's knee. Now, my understanding is that in the US, they actually talk about runner's knee being a different condition. We in the UK call that jumper's knee, but for me, of the runners we see, equal amounts get pain in the outside of the knee, or this pain across the top of the knee. So how does jumper's knee, or patella tendinitis to give it its full name, manifest itself? Well, this presents really with pain coming across the top of the knee, because we have this structure here called the patella tendon. Now, this is the tendon of the quadriceps muscle. The quadriceps are our big 4 muscles in the front of the leg, and running really places a lot of demands on these, as it does the hamstrings. So the hamstring sits on the back of the leg, and these two work together. So if we start to develop imbalances, if we start to develop tightness in these areas, or we have a lack of strength for the demands that we're placing upon that area, we can start to develop some dysfunction through this patella tendon across the top of the knee. And it runs across the top. It's separated from the patella, the bone that sits on here, by a fat pad, and there's lots of structures that can become inflamed and sore. So if you're getting that pain across the top of the knee, patella tendinitis, or jumper's knee, or runner's knee as it's referred to in other parts, can be very common, particularly when we're going downhill. And people are often surprised about this. Perhaps when they're coming down the steps or they're running downhill, their pain becomes worse. But that is because we're looking to decelerate or brake and create what we call an eccentric muscle contraction, which is one of the harder muscle contractions, so therefore places more stress on that knee. So pain on the outside of the knee, the very outside tip, that's your runner's knee, or iliotibial friction band syndrome. And then patella tendinitis, or jumper's knee, is where we're getting pain across the top of the knee. And as with any knee related issue, I often talk about the knee being an area that is beaten up by other parts, most typically looking below to the ankle joint or above to the hip joint. So the key in resolving these issues is to really understand the cause and to assess those joints as to ascertain where that is actually coming from. But moving further up the body to the hip, now we only need to look at runners at the end of, say, a marathon, and you start to see their hips and their pelvis being all over the place, and that nice running form that they had at the start is gone, and it's more just about hobbling their way across the finish line. And this really comes because running, and in particular long distance running, places a lot of stress on the muscles that look to stabilize our hip joint. And these muscles are the gluteal muscles, the glute group that are wrapping around our sort of bottom area around to the hip. So again, what we can see here, one condition I'm going to group and term our gluteal tendinopathy issues. But this really is a group name for any dysfunction in those glute muscles. So if you're getting pain that's radiating out from the hip out towards the hip area, and on the outside of the hip we have what we call our greater trochanter. So if you feel to the outside of the hip, you'll feel a bony point, which is actually the top of the femur bone or the greater trochanter. But the glutes can come in and wrap around into this area. And what we can get when we're running is a rubbing sensation. If those muscles are tight and they've not got the flexibility, they can start to rub over this area. And without diving into this in too much detail, in this area we have what we call a bursa, which separates those muscle tendons from that bony prominence, and this can commonly become inflamed and we get greater trochanteric bursitis. But again, this is being caused by those glute muscles. I often call these muscles the big bullies. They really do have a lot to answer for, and no more so than when it comes to long distance running. So without getting into too much detail about how to resolve these issues, strengthening those glute muscles is imperative for anybody looking to take on long distance running. Making sure they're recruiting correctly, making sure that they're well rolled out and they have the flexibility to cope with the demands that you're going to place on them. Now, the final condition that I wanted to talk about is really around the back and lower back issues. And with a lot of runners, we can see issues around what we call the sacroilliac joint. So the final condition that I wanted to talk about is really SIJ dysfunction. And again, this comes about really via a issue with the glutes in a lot of the runners that I see. If these muscles become tight or are not strong enough to cope with the demands, they can really cause dysfunction into that lower back because they come in and attach into the lower back. If these muscles are pulling and creating too much force in that area, that can cause that joint to almost lock up. The joint in the lower back, so we have a joint between our spine and our pelvis, is held in place by those glutes. But if they become too tight, they can really create a clamping effect on that area and not allow the subtle movements that we need from that joint in order to run pain-free and comfortably. So that's the final condition. And in truth, there's our 7 most conditions. The things that I wanted to get across in this video is the 7 conditions that running can cause and the most common that we see in our clinic. But the truth of the matter is that there's many more conditions that can be seen. And really, when we are suffering with pain as a result of running, it often comes about via what we call overuse injuries. So it's not something that we suffer instantly with, it's something that we're doing slightly wrong over a period of time that builds up to create these injuries. So if you are suffering pain as a result of distance running, I would really encourage you to get some deeper investigation. Feel free to reach out to us because it's imperative that you jump onto this really early to prevent these problems from getting worse further down the line as you're looking to build that mileage. I hope that information's been helpful. If it has, do me a quick favour and hit that like button because that's going to help others to see these conditions. Also, if you've got any thoughts, any questions, or there's other conditions that you think that I've missed off, then drop them below and I'll be keen to see those and let you know if they feature in our top 7 of the running related issues that we see in clinic. And if you haven't subscribed yet, but you're thinking this is helpful content, then why not subscribe? That will really help me to see that this is the type of content that you want to be seeing. So hit that subscribe button now, and then I've just linked to another video here that you can see related to your running injuries.